Hello and welcome to Health Guide on Global Television, your hub for topical discussions on health matters. I am Queen Agaba. As the rainy season unfolds, so does the heightened risk of malaria in many parts of the world. Seasonal malaria, which is usually known as, is the pattern that springs a surge in cases of around specific times of the year. Today, we'll be exploring not only the factors behind this increase, but also focusing on prevention and treatment strategies that can save lives, from understanding how to protect ourselves during this peak transmission periods to discussing effective treatments and steps needed to reduce the impact of malaria in our communities. With our guest on the program, who is Hajia Zainab Ibrahim, the project manager, FCT Malaria Elimination Program. Welcome. It's a pleasure to have you on the program. Thank you very much.
It's my pleasure too.
Thank you. Malaria is very common in this part of our world. You know, malaria, when we talk of malaria, what comes to mind is mosquitoes, obviously. But can you help us understand what malaria is?
Okay. Actually, good afternoon all. Good afternoon, my reporter. Actually, malaria is a parasite, and it is a deadly disease. We all know that, and it's coming from a parasite that happen to be very, very deadly to human life generally. And in the African continent, we have two types of parasite. We have the Plasmodium falciparum, and then we also have another parasite, Plasmodium vivax, which is basically in the sub-Saharan continent. But what disturbs us most in this our own particular continent, that is the African continent, is the Plasmodium falciparum. And as we all know, it is so deadly in such a way that it can lead to death once it is not being treated. But malaria can also be prevented if we know it well, if we really targeted it at the real time. And the real time that malaria becomes so much is during the rainy season, as you said. So between the month of June to the month of October, honestly, the pandemic is high. So there is a lot that the federal government is doing. In FCT, we are collaborating with one of our partners, which is the Malaria Consortium. During the rainy season, we usually do seasonal malaria chemo prevention. And we all know malaria is most deadly to children, most especially from 3 months to 59 months.
Okay, well, you know, before we go to the treatment, where chemotherapy comes in as well, but let's just look at how this malaria affects children in this our region, this sub-Saharan region, particularly children you have just mentioned now, and even pregnant women who are at risk of malaria.
So actually for the children, if children less than 3 months, because of the immunity they have from their mother, they are not really infected. But from 3 months, specifically to 59 months, they are very vulnerable. You know that their immunity actually is low at that particular period, so they can easily be infected. And once they are infected, it is not easy to that particular age group. The same thing with pregnant women. Pregnant women, if she is infected with malaria, in fact, it can affect her unborn child to the extent that maybe probably she will born a child that is with less weight, and then actually it can also lead to death. So these two categories of target group, honestly, malaria doesn't do easy for them. It can lead to death if it is not being targeted on time.
Okay, now let's even look at now seasonal malaria and chemo prevention, how it works and who should receive it.
Okay. Seasonal malaria prevention First, let's look at the seasonal malaria.
Mm.
Chemo prevention. So what we do in this particular SMC, we target usually the children because they are the most vulnerable in terms of getting infected with malaria, because once the virus have got in contact, that Anopheles mosquito, we all know, got infected to the child. From there, that child gets infected, is at high risk of getting malaria. So we target them using SPAC administration of SPAC. We call it SPAC because it has a combination of dosages. We have the sulfodazine, pyrimethamine, and then amodiaquine. These are tablets that comes in sachet, a blister pack. So how it goes, and it is also disaggregated by the age group, because we target the 3 months to 11 months using their own dosage. It cannot be the same with the dosage of the 12 month to 59 month. So what we really do within this particular cycle, because I've already talked about it has 5 cycles in FCT. Other states in Nigeria, usually the season is 4 cycles. So we are privileged to have 5 cycles because we are looking at that particular period at the risk period of contracting malaria. So we have in each of the cycles, we have our health workers. We call them the community drug administrators that goes house to house to administer this particular SPAC, that is sulfodazine and pyrimethamine and amodiaquine. How do they go about it? They use the first day in the cycle. We are starting our cycle for this 5th cycle in this run. We are starting on the 18th of this particular month, which is on Friday. So we have 2 types of pack. One pack belonging for the age of 3 months to 11 months. Then the other one between the age of 12 months to 59 months. So the target group must be eligible. How does eligibility comes in? The person must be healthy. The child should be very healthy, because we are looking at preventing them from acquiring that particular disease. So that child must be very healthy. He shouldn't have any sign of sickness, any sign of fever, cold. If there is any sign of this sickness, that child should be referred to the hospital. The child is not eligible to take the SPAC. So the SPAC is given the first day. We have the sulfodazine, pyrimethamine, and the amodiaquine. The sulfodazine pyrimethamine is given to the child the first day together with the amodiaquine. So how is it going to be given to the child? It is something that is, you put it in very clean water, at least. We have healthcare workers that will also provide direct observed therapy in terms of administering that particular dosage the first day. Then the second day and then the third day, the child will be given amodiaquine only, because the sulfodazine is just for the first day. So these 3 dosages help in preventing the child to get any malaria infection within that particular season. And that child that is given the first cycle should be given the second cycle up to the 5th cycle. So that will prevent the child from acquiring and getting malaria infection. So that is how we go about it. Then secondly, for the pregnant women, we also provide the sulfodazine and pyrimethamine in the facility during antenatal. So that also prevents the pregnant woman from acquiring or getting malaria infection throughout her pregnancy. So for the treatment aspect, any child, I've already said it, any child that happen to get infected with malaria should go to the health facility, get tested. If it is malaria, then that treatment will be given in that facility. And we also have, it is word of nothing to also tell the general public that beyond the seasonal malaria prevention and then treatment within this particular 5 months that we have in FCT, FCT is also trying to come up with another strategy by providing free malaria treatment and testing in all our general hospitals. This is something I need to add to. We have gotten that there is a project that is supposed to come on board. We have our commodities presently. We are about doing the last mile distribution so that the general public should be able to know that beyond the children and the adults should also know that very soon we will have free malaria testing, free treatment if you happen to get tested positive for malaria. So thank you very much. I don't know whether I have added more.
Yes, you have. But let's look at the benefits now. Some of the benefits, side benefits. You've mentioned some of it, but other benefits of this seasonal malaria chemotherapy in this region.
Okay, the benefits of this SMC to the children, honestly, I cannot predict all, because it prevents our children from getting infected, because you know
for
that
a season.
Within that particular season and beyond the season, because after 5 months you find out that that child is no longer at risk of acquiring any malaria infection within that particular period. So it is very, very important. We've already advocated to our religious leaders, our community leaders, please let them try and send the messages so that our children, our caregivers should be able to bring out their children to get that. And this is not done without the help of our partner, because this support is provided by one of our partners, which is the Malaria Consortium. We cannot, we don't know how to appreciate them more, because we've not been part of it. It started since 2012, but we are privileged to start this particular program in FCT in 2022. So it has a lot of benefits. We know the risks involved in malaria. So by the time the children are able to get these services, I can say, in fact, it will reduce malaria a lot. It will eliminate and reduce malaria in the FCT.
Thank you very much. But let's just quickly look at the challenges. This is a welcome development, and we're glad that it will help reduce malaria. But the challenges, particularly in areas where we don't have healthcare facilities, in accessing malaria treatment and how SMC comes in. What are the challenges that are predominant in accessing treatments for malaria?
Okay, actually in the whole of FCT, I believe most of the ward, we have health facilities. We are very, very lucky. I'm very privileged to say that within just a short interval or short distance, you'll be able to find a health facility close by. And within all these hard-to-reach areas, I can say, in FCT we have health facilities, even if it is a small health post. And aside from the health facilities, we also have our traditional leaders, our community gatekeepers that send messages to where we don't even expect it to. So like this, the last SMC we did a lot of flag off in all the 6 area councils, whereby all the religious leaders, the community leaders, traditional leaders were involved. So the messages has been passed to where we don't even expect. So we believe with this particular media engagement too, we'll be able to reach where we are not even expecting to reach.
Okay, so while government and agencies are doing their part to ensure that there is treatment for malaria, what can community members do to also contribute? How can they contribute to reducing the spread of malaria?
Okay, community, in fact, gatekeepers and communities, what we like them to do is to support the program. Because by supporting the program, actually, it will take a long way by reaching those vulnerable populations that we don't even expect it should reach. So they should support any program we bring. It is good for us. It is good for our population, because we know how deadly these diseases are. So if the community gatekeepers didn't support this program, we will not reach anywhere, and we'll continue, in fact, talking about malaria to the last end. So we are looking at eliminating it completely to see a situation whereby FCT is, and Nigeria is malaria free. So for the community gatekeepers, support the program, pass the messages beyond within that particular area. You should be able to reach even the vulnerable community and hard-to-reach area. So that is my message to the community.
Okay, thank you very much, Hajia Zainab Ibrahim. We'll take a quick break now, and when we come back, we'll wrap up the conversation. Please stay with us. We'll be right back. Many thanks for staying with us on the program. If you've just joined us, this is Health Guide on Global Television, your hub for topical discussions on health matters. And before the break, we have been speaking with Hajia Zainab Ibrahim, who is the Project Manager, FCT Malaria Elimination Program. Many thanks for joining us on the program.
Thank you very much.
Just quickly, let me ask you if you foresee any significant changes in how, seasonal malaria is managed in the next decade after now, looking at what the procedures, the programs that have been put in place, what is the future of malaria treatment and how it is handled in this part of the world?
So actually, what I will say is for us to have a sustained program. Sustainability is very, very key, because this program that I'm talking about, the SMC, is being coordinated, is being supported by Malaria Consulting. I'm seeing a situation whereby we should not stop in future, because Malaria Consulting will leave us. So once they leave us, we as government, we should see a way whereby we sustain this kind of program to make sure that, because we are looking at preventing it, eliminating it completely. So by sustaining it, and then other programs that we integrate will be able to eliminate malaria to the last level. Because right now, malaria incidence, the prevalence of malaria in FCT, we have about 20%. So we are looking at a way whereby it should be reduced drastically, to the extent we don't even want to see any numerical figure. So if we can sustain program and then advocate, pass the messages, I believe we should be able to reach a situation whereby FCT is free and eliminated from malaria.
Just for clarity of our viewers, you say people can walk into healthcare facilities to access this seasonal malaria chemotherapy?
No, the seasonal malaria chemotherapy, this particular one that we are doing, is for the children, targeting from 3 months to 59 months, and it is door-to-door administration of drugs. Only that if you go to health facility will direct you to where our CDDs are. The CDDs are the community drug distributors. They are spread all around, and I believe they are even more than expected within each and corner street. You see them with their jackets, reflective jackets, with their bag. 2 of them usually go in pairs. So they are the one that administer these drugs, and specifically to the children. But however, I've already said it, we are looking at a situation, because right now we have a project that is coming on board, and that project is to see whereby if you reach any health facility, we have these drugs available. If you test positive, they will test you for malaria. So if you are being tested positive for malaria, you will get your treatment free of charge without any cover. And we are also looking at a situation whereby the preventive aspect, we see where we have our insecticides treated mosquito nets to be provided to the vulnerable population. But for the pregnant women that goes for antenatal, they have their SP, which is the sulfodazine pyrimethamine, given to them as part of their antenatal package. So we are also hoping very soon they will also be having anything that's supposed to be for them in any of our public health facilities to be given to them free of charge. So we are not praying for malaria, but I believe if you are being infected with malaria, you should be able to get your treatment free in FCT.
Thank you very much. With that, that's where we draw the curtains on Health Guide today. Don't forget to follow us across all social media platforms using @Global TV NG and other handles now showing on your screen. I am Queen Agaba. Thank you for watching and see you again.
Okay.